Welcome to the neck pain breakthrough process. So you're about to learn the most comprehensive and yet simple to implement process to resolve your neck pain as fast as possible. So let's get started for you to jump right into this course so you can learn as much as possible in the shortest amount of time. So my name is Dr. Steve Young. I'm here in my clinic here in Body Solutions at Voorhees, New Jersey, and we've treated over 7,000 patients in the last 20 years, and that experience has given me this unique opportunity to find patterns with patients that have various reasons why they're in pain to find the simplest solution for their pain. And so that's what you're about to learn today. My goal today is for you to understand why you have neck pain, right? The causes. The reason is, once you understand the reason you're in neck pain, you're not only going to get rid of your neck pain, you're going to be empowered to prevent the neck pain from happening in the future, right? Knowledge is not just power. Knowledge in action gives you ultimate power. So the goal is to give you the knowledge and the actions, and together you'll be able to resolve your neck pain and keep it away, right? And so you're going to learn the neck pain breakthrough process, right? A super simple daily routine that you can do in the shortest amount of time to resolve your pain in the next few weeks. You're also going to learn the behaviors, right, to keep your neck pain away. One of the main things that's missing in all medicine right now is behavior modification. You see, if your neck pain did not result from simply falling or a car accident, or I always joke with my patients, someone hit you with a baseball bat in the neck, what that means is your daily life decisions cause the neck pain, right? So that's also like saying your behaviors on a daily choice cause the neck pain. Now, even if your pain did come from trauma, some type of major event, something hit your neck, anyway, your neck actually wants to heal, right? And so the reason it's not healing is because there's obstacles preventing it from healing. And our goal is to find those obstacles and remove them. And that's basically the neck pain breakthrough process you're about to learn. So you're gonna get customized solutions unique to you. Yes, this is not a generic program that everyone does. We have very simplified versions of exercises for you, but at the end of this unique curriculum you're about to learn, you're also going to see what are some unique imbalances in your body that you're going to do that Bob and Jen may not have to do, right? So let's dive right into this. So first, before we get into the actual content, I'm going to share with you some stories of patients here that had amazing success, right? So I want to talk about Jackie. I've actually known Jackie I've treated probably every body part in her body in the last about 20 years. And relative to her neck pain, so Jackie is a counselor at a school, right? So sitting, talking to people throughout the day. And so her job involves being engaged with the person, right? And so obviously you can imagine she's sitting engaged with the person, she's leaning forward, she's interested. Well, the drawback to doing that for 40 plus years is her neck is in a forward position. So she came to me with this chronic neck pain that was bothering her. And so she's, like most patients, have gone through other practitioners without any results. And so what we did, we essentially found out, one, what was the root cause of her neck pain. You're gonna learn the different structures that's irritating the different tissues that's causing your neck pain. And so we did that for her. And then, of course, we looked at her behaviors, right? How was she sitting? And then we modified her position on a day-to-day basis, and that took away some of the root causes of her neck pain. And then, of course, as a holistic practitioner, we recommended some nutritional strategies, some things to decrease overall inflammation in her body, and her neck pain that she's had for years quickly resolved, right? And so the same thing happened to Dan. So Dan is a computer programmer, and I'll never forget Dan's story because during the first day, I asked Dan, hey, how did your neck pain start? What do you think is the root cause of the neck pain you've had for about 12 years? He's like, I know exactly the root cause. So I was like, oh, tell me. And he said, we were in the library. Yeah, back then, people actually used to go to the library before they Google things. And he was like, oh, I was there with my family, and this bookshelf was actually getting ready to tilt over, and I blocked it from hitting my family. And it hit me in the neck, and he's like, that's why I have neck pain. And I was like, okay. So I can see that may be the start of the injury of the neck. But again, we understand that the neck in every which way wants to heal, just like the rest of your body. It doesn't matter what illness you have, your body wants to be back to normal. if you have a continued illness in your body, if you have a continued pain in your body, it's because there's something preventing it from healing. And so in talking to him, he completely didn't think about the fact that he's a computer programmer and he works a lot of hours, right? Like 10 to 12 hours a day, sitting in front of the computer with the shoulders forward, with the neck forward. And so very similar to Jackie, what we did was we found out what was a root structure in his neck. For him was stenosis, and we'll talk about that. And then we modified his sitting position. And granted, he was in constant pain for 12 years. It took about 12 weeks for him to fully get rid of his pain because there were so many things we had to work on by then from all the compensations. And you're gonna learn about some of these compensations later on in this course. But again, once we remove all the obstacles, the mechanical obstacles, the behavior obstacle, and the chemical obstacles, he, like every other patient, healed. Right? And so don't worry, no matter how long you've had your neck pain, it could have been 1 week or 10 years, there is a way to heal your neck pain once we identify the obstacles and remove them. Right? And so let's jump right into the anatomy of the neck, right? So what are some causes of neck pain? So you can see in this picture here, this is a picture of the neck bones, right? The vertebrae in your body. And so you have the nerves that are coming out of your neck, right? So that nerve can be pinched, it can be touched by different structures, right? So we have this disc material right here. That disc can slide back, right back this way in my neck, and that disc can push onto this nerve and cause pain. And so when it does that, it's gonna send pain down the arm, down the neck, right? If you have radiating pain, that's a pretty common cause. Another reason it's called arthritis or stenosis. Stenosis is a very specific form of arthritis. Basically, this nerve here comes out of these holes. Right here, you can see that hole right there. When that hole gets small enough, it pinches and crunches down on the nerve, and that can also cause the same pain, right? So those are like nerve-related causes of your neck pain. So if you've had pain shooting down below the arm, like the elbow here, for sure you have a pinched nerve. Now don't worry, we can teach you how to unpinch that nerve. Now, if you're just having neck soreness in general, there are other structures that can cause a neck pain, such as your muscles around your neck, right? Any of these muscles that's been shortened, abnormally contracted, under excessive amounts of pressure, all of those things can cause your neck pain, right? And so a lot of that has to do with, as you can see in this picture, your posture, right? So we're gonna get into how your posture affects your neck pain, how much weight does it put through your spine, and what are the effects of some of your workstations, your phone use, and your daily postures later on in the course. But just want you to understand the different structures in your neck that could be causing your neck pain, okay? And so you might be living with neck pain. Some people have this mindset that they can tolerate pain. And what that means is, you know, if you've had neck pain for a while, you might be living with a 1 or 2 out of 10 neck pain, and you wait until it's like if you have this course, I'm assuming your neck pain is bad enough where you decided to take action. And for most people, from doing this for 20 years and treating over 7,000 patients, if you've ever been to a doctor or a physical therapist and a chiropractor, they will ask you on a scale of 1 to 10, right, what is your pain scale? 10 being the worst unbearable pain, like take me to the hospital pain. 1 is a tiny bit, 0 being pain-free. What we find is that by the time people come to us, like I'm a physical therapist, typically the pain is already way above a 5, right? 5 to 9 in that range, right? And so when you live with chronic pain, when you decide to put up with pain and tolerate pain, well, there are some consequences, right? So let's talk about some of the consequences, the side effects of neck pain. So there are some mechanical side effects of neck pain, right? If your neck hurts, your body's gonna protect the neck by not moving it as much, and that's gonna cause some stiffness in the rest of your body. It causes stiffness in your shoulders, right? Because if it hurts to reach, you're not gonna reach as much and your shoulders get tight. And as your shoulders get tight, you can actually now have shoulder dysfunction, shoulder problems in itself. And later on in this course, you're gonna learn how to test your shoulders to see, have your shoulders already become dysfunctional because of your neck pain, and it will teach you how to resolve that, right? So the goal in this course is not only, again, to resolve your neck pain, it's to resolve all the side effects of your neck pain and to give you the power to prevent it from ever coming back. Pretty awesome. And so those are the mechanical side effects. Your entire body become more stiff, especially the shoulders. The shoulders work hand in hand with your neck, right? So we want to make sure that we detect all of the side effects and restore them. So next, your nervous system, right? So there's multiple studies now showing that when you live with chronic pain, and chronic pain is pain defined as it's been there for more than 3 months, right? So once your pain has been there for more than 3 months, your brain and your spinal cord actually makes physical changes because of the chronic pain. And what are some of those changes? It actually becomes more heightened to pain, right? And it kind of makes sense. Think of it as pain is a signal your body and your nervous system is trying to tell you, hey, do something about it, there's something wrong. And if you keep ignoring it, interestingly, it actually starts to magnify, it starts to increase. It actually sends stronger signals to you to say, hey, please do something about the pain. And so the drawback is if we keep ignoring it, our nervous system actually in our brain becomes heightened and more in tune to pain, right? So it's this vicious feed-forward cycle where pain causes you to feel more pain, right? That's just one of the many side effects on your nervous system. We also understand that because you're in chronic pain, and this study was done specific to low back pain, but they're now understanding it applies to all chronic pain, which is your body actually releases more chemicals, heightened chemicals of these inflammatory chemicals, and these chemicals are called interleukin 1B specifically. These interleukins are actually some of the root cause chemicals of most illnesses, right? Chronic inflammatory chemicals that increase because you decide to live with chronic pain. These chronic inflammatory chemicals increase, and these are the inflammatory chemicals we're starting to see in research since 2014. They basically are the root causes of heart disease, diabetes, hypertension, Alzheimer's, dementia, cancers, right? Most of the diseases that you know that traditional medicine treats with drugs to treat the symptoms of, well, the root cause is these inflammatory chemicals in your body. And we're now understanding that when you live with chronic pain, it increases these very chemicals that are the root causes of most illnesses, right? So super important to take action now to take this course seriously and to apply it on a daily basis to resolve your pain. Because what we're really doing is we're resolving not only your pain, we're resolving the entire process that basically leads to most illnesses, right? Our bodies are not meant to live in pain, right? And pain is a signal that, hey, something is wrong, right? And so that's the effect of the nervous system. And of course, there's multiple studies on its mental effects, right? It leads to depression, as you can see, learned helplessness, guilt, anger, withdrawal from friends. Basically, you're just not happy when you live with chronic pain. Your temper is shortened, your short-term memory decreases, right? Like if you feel like you're living in brain fog, you can't remember things as well, you can't think as well, you're just not feeling up to your full self. Well, these are some of the effects of living with chronic pain. And so again, we can start to see that the more quickly you take action to resolve your pain, the more profound the benefits it has on your body, right? And so what is this process? Well, I call it focused simplicity. We apply this to all the body parts that we resolve. It's focused simplicity. What this means is there are numerous courses out on the internet, and you can go to multiple doctors, physical therapists, and all different practitioners, and they'll give you different recommendations. Well, luckily, I've been able to treat over, again, 7,000 patients in the last 20 years, and it's all about seeing the pattern and recognizing what is the easiest, simplest things that you can do, and you focus it and you do that a lot, and that's going to give you the quickest results, right? Because most places and most experts online are giving you the shotgun approach. Like you do 10 different exercises and hopefully one of them works. I'm just not a big fan of that. That does work, but it takes a ton of your time. And who here has too much extra time they need to spend? Well, not me and not most people. We want to make sure we're very efficient with our time, and this is why we use a focused simplicity approach, right? Very little things that are done throughout the day that gives you the biggest benefits. You're going to learn about what those are, right? And so the result of that is you're going to be able to fix your pain instantly. Now, I don't mean instant like in 1 second, right? I mean, this is going to be the fastest path to pain relief for you, right? You're going to learn how this works in just a minute, right? And so one of the key concepts, again, I want you to fully understand is that your body wants to heal. All we're doing is identifying the obstacles and removing the obstacles from healing. It is literally that simple. It is not how traditional medicine is practiced. It is how real, holistic, truly healing practice of medicine is practiced, and that's what we do here, right? And so it's all about removing the obstacles, right? Because once you realize that the obstacles are there, and we talked about it, they're mechanical, chemical, and behavior obstacles. Once you remove them, your body in every which way heals very quickly, And of course, once we do that, we want to identify all the compensations, which we will do in a minute. And then we remove the compensations, and that fully restores your body back to alignment and back to normal. Everything is normal, and that's how you're going to be pain-free. And that's how you're going to stay pain-free going forward, okay? So we're going to give you some guidance. Now, you might be thinking, with this guidance, how come I have not heard this from some other practitioners, such as chiropractors, massage therapists, and doctors? Well, it's because all medicine right now, typically traditional approaches, do not identify root causes, right? You go to a massage therapist, they massage your muscles, they're only treating the mechanical part, right? If you go to a chiropractor, if they're only just adjusting you, they might also do some massage, again, they're only treating the mechanical part. If you go to a traditional doctor and they're giving you drugs to decrease the inflammation, to decrease the pain, they're only addressing the chemical part, not even in a very healthy way. Right? And so again, once you understand how true healing works, which is a combination and a necessary combination of mechanical, chemical, and behavior, you can start to see why previous practitioners that you have sought out may not be fully effective at completely getting rid of the pain, because they did not see it from those three perspectives. And you need all three for this to work, right? Because what we do, it's about finding the root cause. This is the unique pain breakthrough process. Is to identify the root causes and get rid of the root causes. It's not about treating your symptoms, right? There's so many programs out there that treat your pain, treat your inflammation, treat all the symptoms. We're actually about removing the root causes and all the symptoms go away, right? And that's what gives you permanent relief, right? And so let's jump right into it. What is the neck breakthrough process? It involves three very important processes and unique movements that you're gonna do. And I'm going to talk about what movements you're going to do and how you're going to do them. And I'm going to have one of our staff members demonstrate with me how to do these movements so you can clearly see how to apply this on a daily basis. All right, so now we're going to demonstrate the exercises for your neck movements and to restore the alignment of your neck. So the first exercise you can see on the screen, the neck alignment exercise. In the clinical world, we call them chin tucks. So I have Nick here to demonstrate the movement. And what you're gonna do is you're gonna make sure the first thing, you wanna have your chest as normal and up as possible. You don't wanna do this exercise while you're slouched. And you can do this exercise either seated or standing. And so Nick, you're gonna go ahead and do your chin tucks straight back, right? So your chin just goes straight back. Excellent. And when you do this, you're gonna feel some pressure on the back of your neck, which is normal. So you're gonna have Nick demonstrate 5 repetitions facing you. And that's about the tempo that you want, nice and slow and controlled. You can definitely use your hands to guide to make sure your chin doesn't go up or down as you go straight back. And now you can go ahead and face me. We're gonna give everyone a side view, same thing, 5 more repetitions. As you can see, Nick's doing a great job of holding an ideal posture. Again, as a reminder, you do not want to slouch while you do this. Ideal posture. And you can see that the head is just moving back and forth without tilting up and down. And again, it's very helpful to use your own fingers to guide, but obviously after you do a few of these throughout the day, you don't have to use your hands all the time. Just in the beginning, it is helpful to use your hands. Great, and so that's a chin tuck. And now the protocol you're gonna wanna do is during the healing phase where you're trying to get the pain away from your arm, if you have any sort of pain down here or this side, you wanna do at least 10 repetitions every hour. Right? And so what you might find is that the first time that you do this, you're gonna do a set of 10 and assess how it feels. If it's actually moving the pain closer to your neck, which is extremely favorable, you wanna continue to do sets of 10 until the pain is either gone or the pain is only at the base of your neck, and then you're done. And at that point, you just do 10 every hour just to make sure that the neck is in alignment. If you have a disc issue, that you'll see in the customized portion of the program that the disc is centralized, right? And so again, 10 every hour, unless you're having symptoms that's moving closer, and after 10 it is not all the way gone, continue to do sets of 10 until it's all the way at the base of the neck or gone. Right? So now we're going to move on to the next movement, which is the doorway stretch. So any door frame you can use. I'm going to have Nick demonstrate. You're going to have your arms placed on the door frame and your hands are at the height of your head. Right? And you can see Nick is standing in a split stance. One leg is in front of the other. It actually does not matter which leg is forward and which leg is back. And so what you want to do is you want to go ahead and lunge forward, keeping your chest up, You're gonna feel stretch in front of the chest and shoulders. You wanna keep the stretch non-painful, right? Extremely important that it is not a painful stretch, just tension without pain. And as you lean forward, this is a muscle stretch that you wanna hold for 30 seconds. Research has shown 30 seconds is the ideal duration to hold a stretch. You do wanna keep your stomach braced in tight. If you don't, your back will hyper-arch, over-arch, and that could bother your lower back. So you wanna keep your stomach tight, your chest up, hold the stretch for 30 seconds. And after 30 seconds, you're gonna wanna drop the arms down just to get some circulation back into your arms for maybe 3 to 5 seconds. And then you're gonna put your arms back on the door frame and repeat for 30 seconds, right? And so these muscle stretches, the key is to make sure that you do 5 repetitions in the morning, minimum. Minimum is 5. If you're really tight, you might wanna do 10 repetitions. And you know you're very tight if, as you do this, your chest actually makes a straight line with your arm. If you notice, Nick's, he's pretty flexible, so his chest is in front of his arms. If you do this stretch and your chest is basically making a straight line with your arm, it means you are pretty tight, and you might want to do 10 repetitions in the morning for 30 seconds each. And then every hour, do one 30-second stretch every hour, right? And so as I'll explain later in the video as well, but basically with every repetition that you do, the muscle stretches out, but in the next 4 hours, unless you stretch again, the muscles want to fully tighten. That's why you want to do the 30-second stretch every hour. That's like the key to making sure this works for you and works extremely quickly, right? So very important. And so if you do have some symptoms down the arm when you're doing this stretch, that's normal. It is stretching one of the 3 nerves. Again, you'll learn about the customized nerve stretches later, but it is normal to have some symptoms. As long as they go away within a minute or 2 when you're done, that's completely normal. Okay, so that's the doorway stretch. And now we're gonna do the open shoulder stretch, which is a shoulder extension stretch. So Nick, you can go ahead and stand over here. And essentially this stretch will help, again, take all the tension here off, which then helps your shoulder blades sit back better, which then takes all the pressure off of your neck. And so as you can see, same thing, Nick is standing in a lunge stance that gives him more control. And you can use a kitchen counter, a filing cabinet, a desk, anywhere that has this height. And then you can see that Nick's hand, his palm is actually facing up like this in a proper position. You want to keep your chest up, and then you basically can use your legs to lunge down to get a stronger stretch if you are more flexible, right? So your legs will control the height of your body, which then it controls the strength of this stretch. And ideally, you want to feel the stretch right in the front of the shoulder and even down sort of the front of the arm, the bicep muscles. That's the stretch. And again, just like the doorway stretch, we're talking 30-second holds, right? Relax, get the circulation back for about 5 seconds, and then you repeat. And same thing, you want to do 5 repetitions for 30 seconds in the morning, and then 30-second stretch here and there throughout the day. Right? You just need any surface, put your arm up and go down. So we're gonna have Nick demonstrate facing me this way, right? So you give you a side view of what's happening, right? So split stance, lunging down to control the stretch, keeping the chest up is the key. This position does want to drop your chest. It's very important that you keep your chest up during this stretch. And again, you're gonna feel that stretch in the front here. Again, as you notice, the palm is facing up, not down, right? Facing up. Right? So that's 5 for 30 seconds in the morning, 30-second stretch every hour. And so as you follow these 3 movements, this will help decrease pressure in your neck so your neck can actually heal, because we're taking one of the main obstacles of healing away from your body. Right? So now let's go back to the rest of the presentation. In the class, you can learn much more about how to customize the movements specific to your neck pain. All right, so we're back. So make sure you watch those videos to know how to do those 3 key movements, right? The neck alignment, the open chest, and the open shoulder. Those are extremely important to fix your neck pain, right? And this basically, from treating over 7,000 patients, this applies basically everyone with neck pain. Now, let's go into unique to you, customized to you, what you may need to do additional to these 3 movements that you do on a simply daily basis that resolves your neck pain. And so one of the things that we want to talk about before we get into the specific movements is your habits, right? So those 3 movements that you just learned, those 3 things will address the mechanical part from a stretching movement perspective. Obviously, we want to look at your habits, right? And so we have sitting, we have your workstation, and we have your phone. And so right now, let's just cover how to properly sit at, a chair, right? And so I have a chair right here. So most people are sitting forward like this, working on the computer, right? And so what you really want to do is you want to make sure you're using the chair optimally to support your neck and your back. And so that involves scooting as far back as you can so your tailbone touches the backrest, lean back against the backrest, and have your elbows rested on the armrest. This is very important. If your elbows are not rested on the armrest, right now, if I'm sitting in this position like this is about an 80-pound dumbbell on your head the whole time, right? 80 additional pounds of pressure going down your neck, crushing your neck all day as you're working on the computer. This, scooting back and using the armrest, takes that immediately away, right? And now, I am of average height for this chair, so this chair is actually perfect for me. You might be taller or shorter, so you want to make sure you have a chair where the armrest height is adjustable. And so you want to adjust it so if you tuck your elbow to your side, the armrest should be 1 inch higher than the point of your elbow, right? 1 inch higher than the point of your elbow. So you want to adjust the height so it's 1 inch higher than the point, and this way you can rest your elbows on the armrest and work on the computer and do what you need to do without your neck muscles ever turning on significantly, right? And again, you want to make sure how your neck is positioned. You don't want to have your neck forward. And the other key critical part with your workstation is the top edge of your monitor should be 2 inches higher than your eyes, right? 2 inches higher than your eyes. You want to make sure that if you're using a laptop like I'm using now, that you put the laptop screen at the proper height, 2 inches higher than your eyes, and you just buy a separate keyboard, a wireless keyboard. It's on Amazon. We'll probably put a link in the course materials for you to buy. And so the wireless keyboard allows you to have the keyboard at the right height, which is elbow height, with the monitor at the proper height. Right now, if you're using a desktop, obviously you don't have to buy a separate keyboard. You just put the keyboard at the right height, again, which is elbow height here, and then you put the monitor, adjust the height of the monitor so the top edge is 2 inches higher than your eyes. Now the rest of the workstation setup, you want to make sure that anything that you reach for on a repeated basis, it could be a phone, it could be the mouse, it could be a stapler, whatever you're using at your workstation, if there's anything that you use on a regular basis, I would say more than 3 to 5 times a day, you want to make sure it's within 16 inches of your chest. And basically what that means is you can reach it without having to do this, right? Because if you repeatedly have to lean to reach that thing, that takes a tremendous toll on your neck and your back. And so if it's within 16 inches, that means you can get it without ever moving your body, right? Like this, right? So all the things that you need on a frequent basis, 16 inches. Now, the last thing is, obviously we now know sitting all day, if your job does involve sitting all day, it is horrendous for you, right? So new research shows that an hour of sitting takes 7 minutes of your life away. Right, let me repeat, 1 hour sitting takes 7 minutes of your life away. Now I did the math. If you work an 8-hour day, 8 to 10 hour day, 5 days a week, that basically means you lose about a year of your life for every 20 years that you work, right? A year, that's a lot. And so you want to make sure that you get up from the workstation frequently, or you want to get a standing desk with modifications, right? And so again, look, if you are in this course, of course you're watching this, make sure you join the Facebook group page that we have for all of you. In there, I'm going to be sharing with you workstation setup tips, standing workstations, and we're going to be solving this problem for the world in the next couple of months. We're going to have a solution to this that basically you're going to be more healthy as you're working, which is incredible. And so you want to make sure that if you're sitting all day, in the meantime, you want to get up about every 30 to 40 minutes and walk around and then sit back down. If you have a standing workstation, you want to make sure that you don't stand statically. You do want to move your body around. Again, we'll cover more of those details in the Facebook group page, right? So if you work at a computer, at a workstation, make sure you join the Facebook group page and we're going to discuss with you all of those details, right? So the last part in this section, behaviorally and habit, for your habit is your phone, right? So most people are, looking at their phone like this, down like this. You want to make sure that when you use the phone, you have it again at eye level, right? This avoids the chest down, neck forward position, which again puts about 80 pounds of pressure on your neck. This will keep you in ideal posture, okay? And so if you're reading, right, some people love to read, and instead of holding the book down here like this, what you would do is you could set up like a big pillow on your lap. You rest the elbows on the pillow, and now the book can be at the right height without any muscles working. right? Because if you hold the book forward like this for a long time, just like if you hold your phone like this for a long time, it's actually pretty rough on your neck, right? So we recommend this on the phone because most people are maybe just sending some text messages real quick. If a minute here or a minute there, that's okay. But if you are reading a book or a Kindle, you want to make sure that you put a pillow on your lap, you rest your elbows on the pillow, and you have the book, Kindle, phone, whatever device that you're doing at eye level. Extremely important, okay? So that's the behavior process of this. And now we're gonna go into some of the customized solutions for you, right? And so this is the bonus material for you. This is designed to be customized to you based on your unique reasons why you have neck pain, right? So the previous neck pain breakthrough process, the 3 movements, basically that will help everyone. Universal, it doesn't matter why you have your neck pain, those 3 movements will basically reduce pressure on your neck, restore the alignment. It's only gonna help. Now, if you have different types of neck pain, you wanna be aware that you either have, if you have neck pain shooting down your arm, you either have stenosis or a disc issue, right? So we're gonna go through some movements that you're gonna do right now to test, do you have one of these, right? And so how you're gonna do this is, you're just going to look, I'll give you a side view, you're going to tuck your chin to your chest like this, and then look straight. Tuck your chin down like this, and look straight. You're gonna repeat that for 10 times, and you're gonna assess how is your neck pain, right? By looking down and going forward, if you have any kind of radiating pain down the arm, or just your neck pain, is it getting better or getting worse, right? And so if the pain is moving closer to your neck, if you have shooting pain down your arm, and you look down, and the pain is actually coming closer to your neck, it means you have what's called stenosis. It means that the hole that the nerve is coming out of is being, it's too small. And when you look down, what happens is it makes the hole bigger, takes the pressure off the nerve, and relieves your pain. Typically, I can tell you that if you're having neck pain and you're above the age of 45, we'll say, it can be stenosis. If you're under 40, most likely you do not have stenosis, right? Just too young to have that level of arthritis, right? So if you're watching this and you are above age 45, do this test, look down and see how the symptoms are going. Now, if you look down and there's either no change, or actually if the symptoms are worse, then it may be something else, right? So the next test you wanna do, we wanna test for a disc issue, right? So this one, again, is the chin tuck. It's the same exercise that you did in the neck alignment process, right? But we're gonna modify it. So you're gonna tuck your chin back and then look up. Tuck your chin back and then look up and lean all the way back, right? And so the chin tuck, you just kind of did a straight tuck, the neck alignment movement. This, you're gonna tuck and then look up. And you're gonna do that 10 times, right? And so if that relieves your pain, again, if it makes the pain closer to the center, it takes away the pain in the arm, then you may have a disc bulge. And what you want to do is, if you have a disc bulge, you want to do this, right? So you want to tuck and lean back. You basically, you're going to modify your chin tuck, right? This, right? And you're going to modify to also lean back. What that means is the 3 movements that everyone is going to do, you, if you're positive for this test, meaning if you lean back, tuck back and lean back, and that actually helps reduce the symptoms, you're going to do this version instead of a straight tuck, right? And so you're gonna do that basically 10 repetitions every hour throughout the day until your pain resolves, and it'll resolve pretty quickly. And so if you have a disc issue, not only are you gonna do that 10 times every hour, you need to avoid looking down, right, chin to chest for the next 2 to 3 weeks, right? Because if you look down, it basically pushes the disc back out, and the chin tuck and lean back is designed to push the disc back in. And we need the disc to stay still. We need the disc to stay in a proper place, which you are encouraging it to go into the proper place by doing a chin tuck and then leaning back, right? Now you wanna do this with very light pressure. You don't wanna go until it really hurts. More is not better in this case. You just tuck back and start to look until you feel pressure and you feel relief in your arm. Stop there and then come back to neutral. Tuck back, lean up until you feel pressure, and you start to centralize your symptoms and then come back to neutral. Again, you want to do 10 repetitions at a minimum. You could do more. The key is not looking down, right? Just to repeat, you cannot look down like this for the next 2 to 3 weeks. That is the cure for your disc bulge, right? That is going to help the disc go back into the proper position away from the nerve, and we need it to stay there for about 2 to 3 weeks for basically a scab, like scar tissue forms, preventing this from popping back out, right? Once you do that, you're now in the clear, right? And so now, if you have positive first test, if you look down and that actually relieves your pain, and you're above age 45 and that's working, that means you have stenosis. Same thing. So you don't have to do that as frequently. You don't have to do it 10 times a day, but I do, or every hour for 10 reps. I do recommend that you try to get as close as possible to that protocol, right? So every hour you just kind of look down, hold for about 3 to 5 seconds, and then look straight. What that does is you're basically taking pressure off the nerve, allowing the nerve to heal. Remember the whole concept, your nerves and your body does want to heal. Something is obstructing the healing. So in this case, it's basically your bones, and there's some ligaments and things crunching down on the nerve, and you're basically just giving it a break, right? You're not smashing it every day. And by looking down, that's gonna help you take pressure off the nerve so it heals, right? And so you're gonna do that, basically a 3 to 5 second hold, 10 repetitions every hour, and that will help take away the pressure on the nerve so it can actually heal. You're gonna wanna do this for about 2 to 3 weeks. It could be longer. It really, with a nerve pinch, it depends on how long it's been pinched for. If you've had a pinched nerve for more than 3 to 5 months, the nerves take time to heal. They heal very slowly. You're gonna learn about some nutrients that can speed up nerve healing in this course. And so you wanna make sure that you do this for as many weeks as possible until it resolves. Typically, it can range anything from 1 week. We've seen this for acute cases, meaning if you've had it for less than 3 to 4 weeks, this will go away in a week or 2. But if you've had it for more than 3, maybe even 6 months, this may take up to 6 to 8 weeks to heal, right? Because we can't make your nerves heal within a day. They just heal much slower than your muscles, right? But you want to give it time for this to heal. And so that's going to help take pressure away from the nerve. Now, additional to this customization for you, there are some other imbalances, right? And so we talked about your shoulder can start to compensate. Sometimes we see that the neck stiffness and pain makes the shoulder tight. In some patients, we start to see that their original previous shoulder injury that caused the shoulder to be tight actually led to the neck injury. It's a vicious cycle, right? So some of these tests, you want to make sure we want to test for your shoulder range of motion, your shoulder rotator cuff weakness, and then we want to look at the SCM neck release. So we're going to do that right now. So how do you test for your shoulder range of motion? Well, it's very easy. You basically want to back up your body against the wall. And then you're gonna put your arms against the wall like this. You're gonna just rotate your arms and then rotate your arms down. Now, if you have normal motion, they should both touch and be equal, right? They're basically touching against the wall like this. Or when you go down, same thing, they should both touch against the wall. However, what we find is a lot of people, when they go to like this, the side of your pain, like if you're having pain on this side of your neck, and your shoulder, let's say this shoulder touches and this shoulder only goes to here, that means you have a tight shoulder, right? So if that's the case, you wanna make sure you stretch that shoulder, and you can do that stretch by simply finding a door frame. So we can pretend this is a door frame, and you put your hand on the door frame, and you gently, this is the key, gently, you turn away from that shoulder, right? And as you turn away from that shoulder, you're helping that shoulder rotate this way to get the full motion back, right? So any straight edge, it could be a wall, it could be a door frame, it could be a TV, and you want to put your hand like this, right? So if it's tight, you gently turn away. Do not stretch too hard. You want to keep the stretches medium. And so this stretch, because now we're stretching muscles, just like you learned before, you want to do this stretch for a 30-second hold, and you want to do it 5 times, right? So you would just hold this position for 30 seconds, and then relax and get some circulation back in the shoulder for 3 to 5 seconds. And then repeat for 30 seconds and relax. So you want to do that just like the previous stretch. You want to do this for 5 or 30 seconds in the morning. That's going to help get your motion maximized. And then every hour or 2, just do one 30-second stretch, right? Because like we explained before, when you stretch that muscle out in the morning, you do 1, 2, 3, 4, 5 repetitions. If you don't stretch in the next 4 hours, that muscle fully retightens. That's why it's so important, as it's trying to tighten, you do the 1 30-second stretch, right? And an hour later, 1 30-second stretch. And you get to keep this all day, right? And then when you sleep, you're gonna lose some of it, but the next day you repeat, right? And you're gonna lose some of it, and the next day you repeat. You lose some of it, but over time, you get your motion back, right? So that's how you do your shoulder range of motion stretch and testing, right? Against the wall, rotate and see. And next, we're gonna test your rotator cuff strength. So your rotator cuff, there are 4 muscles in the shoulder that help stabilize the shoulder. And if your shoulder muscles, the rotator cuff muscles are weak, what happens? Well, when you go to reach, because your shoulder is not being stabilized, the shoulder wants to pinch a bone in here. And your brain's pretty smart, you compensate, and it does so by shrugging up to avoid the pinch. Unfortunately, when you shrug up, that puts a lot of extra strain and pressure on your neck, and that could be causing some of your neck pain. All right, so we're gonna test your rotator cuff strength. I'm just gonna step over here, and you can see you just need a towel, and you're going to just grab this towel like this, right? And so I'm gonna test my left arm first. I'm going to grab the towel like this, and so this arm is trying to pull out, and this arm is pulling the other way like this, right? So I'm basically trying to do this, and I'm gonna test and see how that feels. How's that resistance? And compared to the other arm, I'm gonna pull like this and see, is there a strength difference? Or if it's sore. If you feel like one is weaker, and if you test this and you feel some type of soreness, for sure, that means you have a rotator cuff weakness. And if you do, if it's sore, you start off by just pushing isometrically into some type of resistance, right? Isometric means no change in movement. So I'm just gonna demonstrate that very quick. So pretend this is a wall right here. I'm just gonna push my hand, just my hand, out into this wall by squeezing the shoulder blades back, tightening the stomach, and pushing the arm out. You wanna tighten the stomach because that's called bracing. It supports your spine, right? So I'm basically trying to do this, but obviously it's not moving because there's a wall there, right? So you wanna do this for the first 2 to 3 weeks. And why do we do this? Well, it's because if it's sore as you tested it, it means it's inflamed. Now we do wanna strengthen it, but we can't do traditional resistance training while it's inflamed, so we do isometrics. Isometrics can add strength without adding inflammation to your muscles, right? So the first 2 weeks, you wanna push against the resistance, making sure you brace first, and you wanna do it for 10-second holds, and then you relax. And you do a 10-second hold, and you relax. So this is 10 seconds for 10 times, and you only need to do this once a day, right? So 10 seconds, 10 times, once a day. You rest 3 to 5 seconds in between each repetition, right? However, if you do this and you're not sore, right, your muscles are fine, you can basically grab any elastic band. You could use any resistance available, right? So let's just pretend this is an elastic band, and so you attach this to something sturdy. You can actually even hold it with your other arm. You basically just take this arm and you pull it across like this, right? So now we have movement. And this you can do traditional, we'll call it traditional strength training, where you pull out and then you resist and come back in. You pull out and resist and you come back in. If you notice, again, I have my shoulder blades back, my stomach's tight and braced. You want to make sure you brace first, and you go out, and you can basically do 3 sets of 10, right? 3 sets of 10. And you can start off with light resistance just to get used to it, and you want to do this every other day, right? Because you can't do resistance training every day. It builds up too much inflammation. You need a day of rest for your body to compensate. Unlike the isometrics don't really build inflammation, and so you can do that every day, right? And so just to review, if it's sore, you do the isometrics 10 repetitions for 10 seconds once a day, every day, for about 2 weeks. And you know you can do this version. You want to make your way to this version after 2 weeks, because you can retest. If you do the push, right? If you do this test again and you resist as hard as you can, and now there's no more soreness, that's when you can progress to using an elastic resistance band, or you can just use a towel using your other hand as resistance like this, right? So that's 3 sets of 10 every other day. And so you can do that basically for about 4 to 6 weeks to really increase the strength of your rotator cuff. That's about how long it takes. And you know you can retest to see if they're even after 4 to 6 weeks, right? It could be longer depending on how weak your rotator cuff is. So between the stretch and between the rotator cuff test, that's going to help take away the compensations. Also, it could have been a root cause of your neck pain. Again, if you're positive for these things, you want to do this. If you're not, you don't have to do these things. So the last one is the SCM neck release. What does SCM stands for? Well, it's a very long word, sternocleidomastoid, right? And so it's basically a muscle that goes in front of your neck right here. And this muscle is very common to be tight if you're working on a computer, right? And so how do you know if you need to do this release? Well, what you could do is you could just stand in your normal posture. You could just take your cell phone and do a selfie from the side. and you want to look at the picture, right? And so if you look at a picture, if your neck is not in alignment with your shoulder, you're going to want to do this. Now, how do you check if the neck is in alignment? Basically, if you look at my posture, if I drew a line down from my ear, it basically goes through my shoulder. Now, if you look at your picture and your ear, if you draw a straight line down, does not go through your shoulder, it's actually in front of your shoulder, that means this muscle is tight. So that's the test, right? So it'll hold your normal posture. Don't fix your posture because you're taking a picture, because it gives a false, false negative, right? And so just stand how you normally would stand. Let's just pretend it's like this, and then you take a picture and you kind of see that it is forward, right? You're gonna wanna do this, right? And so this release is the fastest way to lengthen and stretch out these muscles. So I'm gonna demonstrate. What you're gonna do, so I'm gonna demonstrate on my left one first. You're gonna do both sides. I'm just gonna demonstrate on one side. So the side that you wanna do it on, this is my left side. You wanna turn a little bit to the opposite side. So you wanna turn towards the right, and you're gonna look down. So almost like basically you're looking down at your opposite armpit, right? So if you're gonna do your left side, you're gonna start to look down at your right armpit. And so once you look down at the right armpit, you're gonna take your fingers, and so the muscle starts right here, right? So if this is the center of your collarbone, it's just about 1 inch and up right here. This is where the start of the muscle. So I'm gonna look down towards my armpit. I'm gonna take both hands and pin down the muscle like this, right? Pin down means I'm pushing in and down, like in and down. So I'm gonna push in and down while I'm in this position, and then I'm gonna slowly look up and turn towards the left like this, right? So I'm moving in a diagonal pattern. I'm going from down right to up and left, and that's going to release this muscle. So again, down and to the right, push on the muscle and in, and then if you notice, this is about the tempo you want to go. It takes about 5, almost 10 seconds to go through that process, right? So look down, pin the muscle against just above the bone, the collarbone. Don't push just on the bone. It's about 1 inch above the collarbone. It's kind of soft like this. If you push into a bone, I'm sure you can hear the tick, tick, tick. That's my collarbone. That is too low. You want to make sure it's 1 inch above it. So here, in and down, pin it down, and then slowly look up and go that way, right? So you're basically turning left and looking all the way up. And so what you want to do is you want to do that 10 repetitions on one side and 10 repetitions on the other side, right? If you're doing the other side, everything's just reversed. You want to look towards the opposite armpit, right? Pin it down and look up that way, right? And so you want to do 10 each side. This only takes maybe 2 minutes at most. And you want to do this maybe 3 to 5 times a day. And that will start to release this muscle so you can actually be in this ideal posture without your muscles being pulled on, right? Because if it's been shortened, if the muscles are tight and you try to get into proper posture, your brain won't like it, because there's a constant pulling, a constant signal to these muscles that says, hey brain, I'm being pulled on, something is wrong. And so your brain's gonna wanna take that tension off, and it goes back into this shortened position. This takes the tension out of the muscles if they're too tight, right? So you wanna do this release so you can actually be in ideal posture without having to constantly remind yourself, right? That basically is one of the key muscles that's perpetuating this forward head posture that we see so common. In fact, really, if you're watching this and you have kids, and a lot of kids are on their electronics, this program is amazing for them. This release in the 3 movements is amazing to help keep their posture as ideal as possible, right? So you can share these movements with your kids if you have kids. I have my 2 daughters, of course, doing some of these stretches on a regular basis because the world and the electronics tends to force the body and the neck to be forward, okay? And so those are the customized motions for these imbalances. Now there's a little bit more for the neck. So if you do have pain radiating down the arm, which either the tucks or the looking down is designed to take the pressure away, one of the drawbacks is if you've had that for a while, the nerve from being pinched and crushed and inflamed, it gets sticky, right? So imagine like my shirt, when I move my arm, it's supposed to slide on my skin. Well, if you pin it down for too long, it gets inflamed and sticky. Now the shirt gets stuck on the skin and I can't move as well, right? Because the shirt can't slide. That's like the nerve can't slide. So you're gonna wanna do some nerve stretches, right? Yes, you can actually move your nerve around and glide them. So I'm going to teach you, there's 3 different ones, and how you're going to know which one you need to do. You may not need to do all 3. You might only need to do 1 of 3, or maybe you need to do all 3. It all depends on where you've had the pain, right? So if you had pain or tingling or numbness down the arm, and it's in this side of your hand, right? So the front side of your hand with these 3 fingers, right? So this is the nerve stretch or glide really that you're going to do. So you're going to start off in this position, and you could be seated, you could be lying down, you could be standing. And then what you're going to do is you're going to tilt your neck towards that side and open up your hand. We call it like, pretend like you're getting change at the toll booth, right? So you extend the elbow and then hold out your hand. And then you're going to let go and tilt away. You're going to go towards it and get the change, and then tilt back and go away. Okay, so that's 10 seconds, right? So 10-second holds and then relax. 10-second holds and relax. You're going to do that 10 times. You're just going to do this 3 times a day, morning, afternoon, and night. You're going to add this on top of some of the other things again if you have symptoms in these 3 fingers on the front side. Now, if you've had symptoms in these 3 fingers, like the pinky, the ring finger, and this half of the middle finger, and it's going to be more sort of on the inside of your forearm, if that's where you've had your pain, then you want to do this version, right? So you're going to tilt towards it, and you're going to get into, we call it holding the waitress tray, like holding a serving tray like this, and then you're going to relax and tilt away. And you're going to go towards and hold the tray and relax like this, right? Same thing, 10-second hold, 10 repetitions, 3 times a day. Now, if you've had symptoms on the back of your hand here, then you're going to do what we call the handoff. I'm going to step in front here to show you. So imagine if you ever see track and field and they get the handoff of the baton in a relay race. So you're basically going to, you can just stand normally. I'm just going to stand like this so you can see better. So you're going to have, let's pretend it's your right hand. You're going to tuck your thumb in your hand like this. You're going to start off in this position. You're going to tilt your neck towards the side that you're having symptoms. In this case, we're going to pretend it's my right hand, like this. And then you're going to go back, right, like as if you're about to grab the baton, and then tilt away and bend. Tilt towards and stretch, 10 seconds, and then tilt away and bend. Okay, and so you're going to, same thing, you're going to do that 10 repetitions for 10 times, 3 times a day. Again, if you have pain in all 3, your entire hand hurts, you actually need to do all 3, right? Or if you only have pain on this side, but it's your whole hand, then you need to do this one and this one, right? So based on where you're having symptoms, if it's these 3 on this side, it's just this version. If it's these 3 on this side, it's just this version. If it's in the back of the hand, it's the other version, like the baton handing version. If you have it everywhere, you need to do all 3, right? Or a combination, you might need to do 2 of the 3, depending upon where you have your symptoms, okay? So that's gonna help free up the nerve to restore normal movement in the nerve in your neck and in your arm, and that's gonna help take away the pain, okay? Or tingling, numbness, any symptoms that you're having. So lastly, headaches, right? Headaches are very common with people with neck pain because when these muscles are tight and your head is forward and all these muscles overwork, they crunch down on some smaller nerves in the neck, and that can cause occipital headaches. They're called headaches basically that come from the back of your head and goes to the side. Different than sinus headaches that are here, you'll know this will work because the headache is more from the back of your neck to the side here, okay? So what you're gonna do, you actually already know the movement, just the execution is slightly different. It's basically the neck alignment, or known as the chin tuck. You're going to tuck back like this, right? And so when we did it on a regular basis, you basically just slowly tucked and then you released. If you have a headache, you want to tuck. You're basically gonna hold the tuck position like this for 2 minutes, right? So if off the bat 2 minutes seems too tough for you, work your way up for 2 minutes. Maybe do it for a minute, then a minute and a half, and then 2 minutes. What this does is the chin tuck for 2 minutes is designed to take a lot of pressure off of the little nerves back here, and that can help you relieve your headache. And you can do that as needed. Whenever you have a headache, just try tucking back for 2 minutes at a time, and that should start to help reduce the headaches that you have. Okay? So as a bonus material, there's a way to do what's called self-traction, right? And so if the chin tuck is not working and you're still having the headaches because it's so inflamed and there's so much pressure, you can do a self-traction technique. Traction just means taking pressure off. It's as if someone's pulling your head off. What you do is you make a fist and you put your chin in this hole here like that. And then you're gonna put your fist against your sternum, like your chest right here. Right, so basically my head is resting on my fist like this. Then you take your other hand and you place it on the very top edge of your head. And with this hand, you are pushing forward, right? So that. So as I put the fist here and I push forward, I'm gonna hold that for about 30 seconds at a time and then relax and then push forward and hold it for 30 seconds at a time. That forward pressure is actually pushing or pulling your neck apart, taking the pressure off. Also very effective for neck pain, especially headaches. So you can do that if the chin tuck for 2 minutes and the other things are not working. That is a great movement to do at home, right? So now you have all the tools to not only do the 3 movements that is basically applicable to all people with neck pain, you now have understood the many customized solutions just for your neck. And as you do this, you will be able to figure out and use these tests and these exercises to fully restore your neck back to normal from a mechanical standpoint, right? And so your success, right? What does that mean? It means you want to use your daily routine. Keep in mind, the stretches are 5 for 30 seconds in the morning and about 30 seconds every hour or 2 throughout the day. Extremely important, right? You want to make sure that you use your customized solutions, right? So all the things that we just went over, you actually put them into action, and based on the test that you were positive for, those are the things and only those things that you need to do. You don't need to do them all, right? If you didn't have any positive tests for those things, you don't need to do that. And then again, you want to modify your behavior, right? So how you're sitting, how your workstation is set up, how you're holding your phone, how you might be reading a book or a Kindle or any devices. Be aware that your positioning of your body fully controls how much pressure is going down your neck. And lastly, use your community. That means 2 things. 1, tell your friends and family that you are actually trying to resolve your neck pain. Here's why that's extremely important. Just imagine you're at work and you might be very engrossed in your work on your computer. You forget, you start to go forward. Well, if all of your coworkers know what your goal is, they're gonna keep you accountable. They're gonna be like, oh, you might want to sit back, right? So you have a whole team helping you and reminding you to change your habits, which is extremely powerful, right? Don't do this alone. Make sure you tell your friends and family about what you're trying to do. Tell them about this course. You can show them this course, right? And so that's gonna keep them and keep you accountable and help you, right? So the other community is the Facebook community that we have. Make sure you join there and participate in the discussions, in the additional tips that we have, the additional health tips, pain relief tips, all of those things. We're here for you. We don't want this just to be a simple course that you buy that you don't use, hopefully, that you actually use, but you also have access to a community of people who understand that you do not have to live in pain, that you can actually live a life without pain, to live the fullest life so you can fully enjoy life and not have a nervous system that's kind of messed up from the pain, not have increased inflammation that's leading to most illnesses, right? The illnesses that no one wants. It's a life that you can actually think clearly because you don't have the brain fog from the pain. This is what this is about. This is about giving you access to a tool where you use it, and it's my life purpose to help 1 billion people connect with their inner solutionite, right? And so just to define what is an inner solutionite, a solutionite, because we're in body solutions here, a solutionite is someone that practices self-love, that sees all obstacles as opportunities, right? Imagine a world where people practice self-love, they take care of themselves. What that means is if you have kids, friends and family, they see you taking great care of yourselves, guess what they're gonna do? They're gonna mirror and model you. So you inspire health. I believe we do not need, all these drugs that's, poisoning our bodies. We can heal ourselves. Sure, there are times where certain medications are necessary, but 95% of the times they're not. They're just treating symptoms. And so you can inspire other people to heal themselves. And then just imagine if you see all obstacles as opportunities. 1, you're solving problems for you, your family, your community, your work, your world. And if you can see all obstacles as opportunities, guess what happens to stress and worry? They go away, right? Because you're just so good at seeing, well, hey, that happened. It's like, oh my God, I can't believe that happened. You go, okay, so there's an opportunity in this. And so you live in peace with no stress, no worry, and no anxiety. And that is the mission. That is the mission of what we try to do here. And so use your community, right? And so with that, I wish you the best of luck to use this program to heal your neck and to prevent the neck pain from ever coming back.